Good morning. This is Dr. Timothy Scott Beck giving you my weekly update. And you'll notice it's on Tuesday, and I apologize for that. Yesterday kind of got away from me rather quickly, which that happens a lot on Mondays. So don't be mad at me. And that just happens, and sometimes I got to respond. I can't do all the little things I want to do. But let's go ahead and get started and talk about some things going on around here and what we need to do and things like that, because I got some informational stuff that I want to give you, and I really appreciate people listening to these videos. It's interesting. Sometimes I get patients who get in here and they get angry or confused about something that I've just explained on the videos, and usually they're the ones that don't want to watch the video, and they delete the video, and they just come in emotional because they don't understand what's going on. So I appreciate it, and I actually want to use these videos to make your experience here better and educate you on some of the challenges that we have around here, because medicine's hard, particularly when you have third parties involved like Medicare and insurance companies and pharmacy benefit managers and pharmacies and facilities and prior authorizations and all that stuff is very difficult. So I'm going to explain some things to you. So first of all, COVID-19, I do still think it's floating around the community. I've had reports of people who've got sick, and and they tested negative for it, but I felt like that's what it was. So we know it's there. I'm not sure how accurate the testing is these days. Certainly we're not having the massive amount of people showing up at the emergency rooms and people dying. Okay. I did hear President Biden say a couple of weeks ago that the pandemic was over. So I think this is more being handled like a cold, and hopefully that's the way it stays. Okay, that's what I'm going to hope for. Again, I get daily questions about getting the boosters. I'm leaving that up to the patient. You have to look at the benefits versus the risk with everything you do. And interestingly, now I think most of the risk for COVID, at least for dying, has been mediated. So just something to keep in mind when you're doing your analysis. All right, so let's talk about a new program. So we're here in the office, and we're continuing to develop our services. And a lot of this is based on what Medicare puts out and what Medicare pays for and what Medicare promotes. And honestly, they're the leader in a lot of this stuff. So the one program that we have tried to use in the past that we haven't quite got off the ground is remote patient monitoring. So we kind of stopped and paused and let time go on so that people could get more used to what the processes and procedures with it and what Medicare expects from us in this program and who's appropriate for it. So I let some time go, and so I've hired a company that is going to assist us with the RPM. It's a third party. And remote patient monitoring is when you have a variable that's out of range. We will provide you with the equipment to monitor that problem, and we'll set up a monitoring system for you. And the monitoring system is so that we can keep up with things, and if you fall out of any of the parameters that I set with this, we can act proactively with the idea of keeping you out of the hospital and keeping you out of trouble. Now, Medicare has been paying for this. This is similar to chronic care management, but really these programs are separate, but they can be used together at the same time. So this is a proactive way that is put forth by Medicare. And please, I didn't come up with this information, this idea. I'm for it, and I'm going to use it with the spirit of what they wanted us to do, and that's to monitor my patients and help them to achieve their goals, help them to live a better quality of life, a longer life, and to stay out of those places like the hospital and keep you from getting critically ill when it's not necessary. And I've been doing this for years. Okay, so this is another tool that we're going to use to do that. So it's called remote patient monitoring. You will receive some calls from my office regarding this, including letters. And I encourage you, if you fit the criteria, to go ahead and sign up. It's going to help you. It's going to help us. And And again, this is something that the government's pushing, but it's not just limited to Medicare. You can do the remote patient monitoring for all your insurance companies. And we've noticed, like over the last year or two, they've increased the reimbursement for these programs from Medicare, which tells me that they like what's going on and they want more of it. So that's my best explanation for it. The three variables that we're going to be probably looking at are going to be sugar, weight, and blood pressure. And we'll be able to provide you with the machines, provide you with the network to help us monitor it, and everything will be laid out for you so it'll be easy for you to understand and to implement. So be mindful of it. You can ask me questions. We know a lot about it here. We've been studying it for a while, so it's a good program and we're going to use it as intended. All right, let's talk about one thing that's happening right now that I want to warn everybody about. It's open enrollment, okay, for Medicare. And so we often get people who have signed up for Medicare Advantage plans who are surprised at what that meant to them, okay? For instance, my own family member who had insurance so that they did not have to pay for anything through the government, the military, and this person was enticed into signing up for a Medicare Advantage plan. So now that person gets copays every time they go somewhere, some small, some large. And they did not understand why they were getting copays now because they'd never had them before. And that's because she had signed over her Medicare benefits to a private insurance company or a Medicare Advantage plan. So, and we see that quite often in here where people are like, I'm not paying that. I got this special program. I'm like, no, that program is not that special. Actually, that program has its own algorithm of doing things, and we try to keep up with them, but I'll tell you, we can't keep up with all the algorithms because they just throw them out there and they change them at will, and then they blame us for not keeping up with them, but it may be 100 that we have to do. So, so I want to be very mindful if you sign up for Medicare Advantage plans. I will tell you that the Medicare plus a supplement is what I consider to be the best plan or the greatest plan. If you can afford that, I recommend that you continue that. The Medicare Advantage plans, you just need to be very inquisitive about what they're doing and make sure they're not selling you a rotten bag of goods, and make sure you understand things. So some common pitfalls. The first one that I want to talk about is we've had a regular patient of mine show up last week, and he had a brand new Medicare Advantage plan. And I'm like, and so we had no idea what it was, but he was demanding to be seen. He wanted to be seen. He needed to be seen. He needed medical care. And we're like, we don't even know who these people are, where they're at. Who sold you this? Well, that's my next question, is who sold you this program when there's nobody in this region that's even on their list? And so I started looking up a specialist for this patient to go for. And mine, we're up there in Northeast Georgia, and this closest specialist was in like Rome, Georgia, okay? So make sure if you do sign up for a Medicare Advantage plan that it's covered with local providers like Northeast Georgia, like Habersham, like all the services here in Clayton, Georgia. Make sure it is, okay, because they've got to sell some of them to people before they realize what's going on so that they can get into a market. Okay, so it's kind of thing, and they're very enticing. Usually they're buying food or buying a meal for you. So just be mindful of those things. The Medicare Advantage plans, please just do your homework. And I can't even hardly tell you a lot about them because I don't even know, okay? But just if you do sign up for a Medicare Advantage plan, expect things to be different. Expect us to have to interface with you differently, okay? And I don't like it, but nobody asked me. And so we're going to do our best to meet people's needs, okay? But just be wary of these Medicare Advantage plans and make sure if you sign up for one that you understand what you'll have to pay. You understand if there's a provider issue. Are you going to have to see another provider? Are you going to be even allowed to go to Northeast Georgia? Things like that. That's what I want you to understand before you sign these. And definitely take down the name and the number of the salesman who sold it to you in case we need some accountability, okay? Because that's a big issue, is Did these salesmen sell you something that was not usable in our community? If that's the case, we need to be able to get back in touch with them so that they can appropriately adjust your enrollment. That's enough for me today. I've talked for 10 minutes. I appreciate you listening. You know, we're here for you every day, 706-782-0016. We love to see people. It's what we live for every day, and we love to take care of people. And if you need us, you please give us a call, and we'll do our best to help you. Have a great day and enjoy this beautiful weather.